Okay, can you hear me now? Okay,
Good
very good,
evening.
very good,
Yes, we do.
very good. But yeah, we're right on just past a few moments past 6:30. I think we're going to go ahead and get started here. And just very quickly, I want to introduce myself. I'm Dr. Kevin Sneed. I'm Dean of our USFL Tunasia College of Pharmacy. And I have the very distinct pleasure of introducing two organizations and the people that make it up this evening. The first organization, I'll just start with ours, is the We Care organization. We Care stands for Work Group Enhancing Community Advocacy and Research Engagement. It's the result of a NIH grant P20 that was in collaboration between USF Health and the Moffitt Cancer Center, focused on health disparities. That grant came to an end a number of years ago, and a couple of brave souls really came together and volunteered and have continued to volunteer to continue to have their organization be viable for the community, with a particular focus on trying to encourage underserved and underrepresented groups to be engaged in clinical research so that we can better our communities at the time that we all need it. As part of We Care, probably about 3 years ago, we developed a wonderful relationship with an organization, Reach Up Incorporated. And through Reach Up, we met, our now lifetime relationship partner in Deborah Austin, Dr. Deborah Austin. And the relationship between We Care and Reach Up as organizations is fostered between the relationships of all of us as people. And We Care, we have Mr. Hiram Green and Ms. Christy Andre and myself, who have primarily started We Care. And then along came Dr. Angela Hillesky as our director that has really just done an outstanding job. And we're here with you all this evening for really a very important discussion in terms of mental health that really needs to be had right now as we're moving forward, especially in the hopefully the shadow of the pandemic. And so I'm going to stop right there because I just wanted to make sure that we did a brief introduction of all the people involved. I really want to thank Dr. Hill, who is our Associate Dean for Clinical Affairs for the USFL Tunasia College of Pharmacy. And I keep her extremely busy in that job. For all of you that are part of Carmel Friendship, I want you all to know it's a 6-day-a-week job, and she has us on her mind at all times. But in our additional spare time, we continue to serve the community, and she's been just the most stalwart partner that anyone could ever hope to have. And so with that, I'm going to pause there, and I'm going to turn it over to our hostess with the mostest tonight, Dr. Deborah Austin.
Thank you. Thank you so much, Dr. Sneed. It is a distinct privilege to be part of this program tonight, addressing such an important issue, mental health perspectives. The host, as Dr. Sneed just mentioned, Reach Up Incorporated, We Care, and we have another partner, as he mentioned, Carmel Friendship Church, led by Pastor Quincy Stratford. And so I want to take this time to acknowledge and thank Mrs. Sherry Hall, who's chairperson of the Carmel Friendship Health and Wellness Ministry. So as we move on, I have the distinct pleasure at this point to introduce all of our panelists for this evening. As I mentioned to them, they are all illustrious and have tremendously lengthy bios. And I just want to let you know that I cut them all substantially so that we wouldn't have to be here until midnight. And so I'll just tell you a little about each of them. I have them in alphabetical order. And once we are completed, we will actually go into the questions that we have for this illustrious panel. Just so excited about that. So we have Erica Anderson, who's a registered mental health counselor intern, who has the tenacity, she says, to see complex tasks through and the ability to coordinate the care of those with clinical needs. Currently, she is a graduate research assistant and adjunct professor in the College of Behavioral and Community Sciences, Department of Mental Health, Law and Policy at the University of South Florida. Dr. Kayan Khanna is an associate professor of mental health law and policy at the University of South Florida. She's a licensed clinical social worker and is currently the vice president of the National Alliance on Mental Illness for the state of Florida. Dr. Connor also is a professional West African dancer and believes in the power of the arts to heal health issues. She is also co-producing a special series that we'll talk about some tonight. This is My Brave, with stories from the Black community as a way to combat the stigma associated with behavioral health disorders and seeking treatment. Our friend and illustrious Dr. Angela Hill is a tenured professor and associate dean of clinical practice and past chair of the USF, a past chair of that and in the USF Tanager College of Pharmacy. One of her duties, as Dr. Sneed just mentioned, as the Associate Dean of Clinical Affairs, includes her serving as the project manager for We Care, where she has labored alongside Dr. Sneed in providing and coordinating the workshops and other presentations related to the management, vaccination, and research related to COVID infection, and has presented several presentations to pharmacy and community audiences about mental health and the neurological and pharmacological aspects of the pandemic. Mr. Antoine Massey is a general psychology doctoral student at Capella University and is a certified mental health first aid instructor. He has over 25 years of clinical experience across various settings, including outpatient specialty clinics, crisis intervention, structured outpatient programs, inpatient psychiatric, large nonprofits, child and family agencies, and school settings. One of his duties as assistant team leader for the Florida Assertive Community Treatment Team includes providing administrative supervision to professionals. Dr. Dora Mays is the founder and CEO of Amazing Services, Inc. She has over 30 years of experience working in social services, has dedicated 27 years of her life specially to the service of military families as a federal civilian employee. Dr. Mays is an accelerated resolution therapist, accredited financial counselor, certified Florida Supreme Court life coach, certified Florida Supreme Court family mediator, certified crisis and trauma professional, certified life coach, and master resilience trainer. And she and the man that I'm going to introduce you to next, who is her husband, are partners along with their daughter in Amazing Services. Dr. Michael Mays is an ordained minister and has been a licensed marriage and family therapist for 10 years. He is certified in Christian trauma and addiction counseling. Dr. Mays is also certified in couple communication and applied suicide intervention skills training. Dr. Mays is the, as I just said, the COO of Amazing Services, where he has the honor to work alongside the beautiful woman I just introduced you to, his wife, Dr. Nora Mays, and their oldest daughter. In 2007, Dr. Mays retired from the United States Air Force after 24 years of faithful service. So I don't know what to say in terms of the great professionals that we have on this panelist, except to say, okay, everybody, hang on to your seats, buckle your seat belts. Let's get this show started. Mm-hmm. And so we're going to start off with talking about the impact on mental health from the current pandemic. And so I want to start off asking you, Dr. Hill, if you would share with us, how has the pandemic affected mental health statistics?
Well, thank you, first of all, Dr. Austin, for serving as our mistress this evening, and Dr. Sneed for all your kind remarks. And I am just so excited to see all of you this evening. And I tell you, I just can't speak enough about having such talented individuals on our panel this evening. And we are just so grateful that they're going to share their insights. But the We Care team has given a lot of thought, and we've been working really hard during the pandemic, trying to educate the community and almost anyone that has ears and will listen about COVID infection, the need to get vaccinated, and really working hard to try to clear up all of the myths and misconceptions and address the controversies that have just been turning, up in social media and in circles. And it just has burdened our hearts that the disparities have fallen on the Black and Brown communities particularly. And so in light of Mental Health Awareness Month, we thought it proper for us to kind of take a pause back from such a focus on COVID and really talk about some of the collaterals of the pandemic, one of which is mental health. And so I wanted to kind of engage all of you, and I want to invite you to use your reaction buttons down at the bottom of your Zoom screen. And I want to play a game called I Have a Friend, because you know how when you have something wrong with you, but you want to ask somebody how to deal with it, but you don't really want to confess that it's you that has the problem. So you'll say, I have a friend, right? So today you have a friend. And all I really want to do is I'm going to call out, I'm going to put some things in the chat. And if you have a friend who's had any of these things occur since the pandemic have started, I'd like for you to use the thumb up reaction and in there. And again, I'm not asking for any confessions, but I just want to kind of show you really how common some of the things that people are experiencing relate to mental health. So I put a few things in the chat, and just again, use your reaction button. So to kind of show you what it looks like, see how my thumb came up? If you know a friend or have a friend that has experienced worry or changes in sleep, lack of concentration, irritability since the pandemic has started, then just give me a thumb up, a smiley face, or something like that. If you've known anyone who's lost employment, lost a loved one, had to, lost a loved one, been sick, hospitalized, we'll stop there. Give me another thumb up, okay? So I'm going to ask Dr. Austin, Mr. Green, if you would look at pages 2 and 3 on our screens and kind of keep a watch on how many thumbs and stuff, are kind of going up. But I just feel that I just wanted to kind of say all of us probably at some point put a thumb up. We have a friend, right, that was affected by this. Now, in the world of mental health, and one of the things Dr. Austin didn't mention is that my days when I was at FAMU, I was pretty much more in psychiatry, and then I kind of evolved into neurology, still in the neighborhood of the brain. But over the years of studying the brain and illnesses that the brain has, one of the patterns that you see are things like depression and anxiety, or even on the other the spectrum, you may have some of our psychoses like schizophrenia, bipolar disorder, and the not. And having worked in state hospitals, public hospitals, worked in emergency rooms, community practice as a pharmacist, and dealing now, like Dr. Connor, with geriatric patients, who have varying disorders that are affecting the brain, a lot of times what we'll see is that people have that first set of symptoms, the worry, changes in sleep, maybe changes in appetite. They're discouraged. And again, if you have a friend, sometimes when we get to the level of diagnosing, we say if those kind of symptoms are occurring, say, for 2 weeks or longer, then it may just, may determine that we need treatment. So tonight we're going to talk about, what does treatment look like? And I was intentional in asking the individuals that I asked tonight to join me on the panel to have this discussion, because since this pandemic has started, our suicide hotlines have tripled in terms of numbers of calls. There is some conflicting data that the number of suicides maybe has not increased, but there were surveys that were done the first 3 months of the pandemic suggesting that probably about 60% or more individuals thought about suicide. And part of it was because of the quarantining. Part of it was because of now having to mask, the social isolation, the sudden change of life, not being able to socialize. I thought I was going to lose my mind when I couldn't see the Rattlers play this past football season. I don't know about you all, but for me, that was really a sacrifice. And so it's those kinds of things that have really made what we've experienced these last 9 or 10 months, you know, they're life changing. We will never forget about this pandemic. My 6-year-old can tell you more about the coronavirus than probably any adult, because she's unfortunately had to listen to the 70 or 80 workshops that Dr. Sneed, Dr. Austin, Mr. Green, and myself have been doing. So she's extremely well versed. But in that, the overwhelming amount of information that has come across the media, social media, it has just really almost caused us to have the semblance of what looks like almost a post-traumatic stress disorder. And what we know for those of us in the mental health field is that past pandemics or epidemics have proven that the psychological consequences of these kinds of experiences, public health experiences, can last sometimes 10 years or more. And so with that, we have got to stop and pause and prepare for what may actually be the equivalent of a mental health tsunami. And so we really want to make sure that those individuals who are affected the most by COVID and have been unfortunately in so many ways, you know, from the pandemic. I mean, the messaging that's come to us, you know, we're the ones that are more likely to get it, right? You know, and it just has compounded the social injustice issues we've had to deal with. It's compounded, you know, the fact that a lot of that loss of employment and the grief associated with the death of friends and family, the hospitalization. I know, you know, having loved ones and you couldn't go see them in the hospital, you couldn't go meet them. If they're in long-term care facilities, you couldn't go in there to see them, you know, and it just really shook us up in ways that we haven't really thought about in a long time. So tonight we just thought we would sit down and talk and really have some discussion about the pandemic and what we need to do to maintain appropriate brain health. But more importantly, we wanted you to be aware of the resources that are out there to help you. So one of the things that WeCare has prided itself on is trying to be a resource that is connected to the community. So the acronym WeCare stands for Work Group Enhancing Community Advocacy and Research Engagement. And so with that, we want you to know that we care. And we care about not only the COVID pandemic, but we've been caring before that. As Dr. Sneed said, we've been caring about the disparities associated with cancer. We've been caring a whole lot about things like Alzheimer's disease. We care about you considering participating in research and learning about research so that we learn how to develop medications and use devices. And we know before they hit the market how they're going to work in individuals like Mr. Massey or Dr. Mays before they hit the market and cause problems. So tonight we do want you to sit back and enjoy and think about it, because all of us need to be each other's brothers or sisters keepers. And so with that, I'm going to stop, Dr. Austin, and allow you to ask questions, but we do want to encourage you, if you have questions, to utilize the chat, and we'll make sure that during the Q&A we answer as many of them as possible. Okay.
All right, thank you. Thank you so much, Dr. Hill. Dr. Hill, you touched on it briefly, but would you share a little more? We know that Black and Brown individuals have been disproportionately affected by COVID. Have you found that to be the same with mental illness? And others of you on the panel, from the perspective of your practice and your work, have you found this disproportionately affecting Black and Brown people in terms of mental health, mental illness?
Yes, well, unfortunately, you know, the disparities that we deal with, we are a resilient group, but oftentimes our resilience kind of shortchanges us and fools us, I think, into thinking that we have it under control and we don't. And we'll be talking later this evening about the downside of not addressing, the issues. But what we do see is that there is a large amount of mental illness amongst Black and Brown populations. And a lot of it has to do with the health disparities that we're constantly dealing with. Certainly a lot of the social injustice issues, and we have hundreds of years of mistreatment. So some of the things that we're experiencing now aren't new. It's just new. It's just being brought out in a broader audience and in that regard. But yes, and then the downside of it is that we tend not to seek treatment. And so we don't oftentimes share with others that we're dealing with issues. Partially, it's just like this, I don't know if it's a cultural norm, but definitely a sign of weakness. And I'm sure that the gentlemen on our panel can allude a little bit more in terms of their perceptions, but I'll stop there and let some of the others talk.
All right. Yes. Any of the others, from the perspective of the work you've been doing over this past year, what have you found in terms of Black and Brown folks being disproportionately affected as far as our mental health is concerned?
Well, good evening, Dr. Austin and Dr. Hill. Thank you so much for allowing us to participate in this very important and worthwhile discussion this evening. I just want to add to what Dr. Hill has already said, in that for the African American community, this whole topic of mental health or mental illness or wellness is really taboo. It's really a topic that we shy away from talking about, because there's something about how we were oriented in our own communities that if we talk about what's wrong with us, then in some way that translates to mean that we're in some way more inferior or even crazy. People said, oh, if you go get counseling, or if you tell someone that you're having these thoughts that just doesn't align with what you should be thinking, then that people are going to think you're crazy and they're going to institutionalize you. Or, we have these real bizarre thoughts, and it becomes, really, we don't talk about that in our family. We don't talk about that in our community. So thank you for having this very important conversation and just putting it out there. You're not crazy. You're not inferior in any way. If you recognize that you need help or you're having some challenges with just adjusting to the changes that you're going through, then in fact, that means that you are astute and in touch with what's going on with you. And if you have the good sense to seek out help, then that is a positive thing, not a negative one.
Okay, thank you, Dr. Mays. Any of the others before we move on to actually go deeper into something Dr. Mays and Dr. Hill just mentioned, and that is treatment options for us when we do get to that point. But anyone else want to talk about how this pandemic has really disproportionately impacted Black and Brown people? All right. Dr. Hill, would you start us off? Just really talking about what some of the treatment options are.
Well, probably the two big categories deal with medication or pharmacological therapies, and usually what they do is help target or correct the some of the chemicals that we think might be imbalanced during various types of mental illnesses. But that's just one part of it. I think a lot of what Dr. Mays, the doctors deal with, my brother, for example, are addressing our ability to cope and have, the ability to kind of deal with these issues without it really destructing self-esteem and all those kind of things. And so I do think the cognitive, we refer to them as cognitive behavior therapies, and they can do much better justice in talking about what all that entails. But those are probably two of the bigger buckets of therapy. And so what I will say, and I'm sure that they'll chime in, culturally, you see different groups actually get different types of cognitive behavior therapy. And one, in light of the fact that, you know, my church is on this evening, I'll say certainly the ministering that we've gotten through the church has been a very common method that we've seen in the African-American community as well as the Hispanic community. But sometimes the combination of all of these are needed really to help people deal with it. And unfortunately, when we're dealing with individuals that may have schizophrenia and in some cases bipolar disorder, and especially with those with post-traumatic stress disorder, it's not an opportunity for one or the other. We have to be diligent in making sure that they're in some cases getting both, and or the cognitive behavioral therapy may take on a different format for those that have some of the more severe psychoses. So I'll allow both Dr. Mazes to talk a little bit more about that.
Yeah, would you please, Dr. Michael and Dr. Dora, talk more about counseling benefiting us as well as the pharmacological treatment?
Yeah, I want to first make sure that we mention, thank you for having me on here tonight. I want to first make sure that we mention what it is that we're treating. So often, you know, we go, oh, I need to be treated. You know, I got something wrong. Well, during this time right here, I know in my past year, I've done a lot of work with some companies and different things like that. And some of the areas that we're looking at are anxiety, we're looking at depression, we're looking at stress, grief. My wife brought one up today, guilt, because we're seeing all these different things. And I want to make sure when we say anxiety, there is that little portion of PTSD in there where you're watching and you're recognizing, you're seeing people who are, and it's traumatic, right? It doesn't mean that you have to be in war to have some small form of PTSD. It's just anxiety is what it is. And so we want to make sure we understand the things that we are treating. So we want to treat these areas, and there are some more. That's not the only ones. You know, and during this pandemic time, we all been, as it was stated earlier, we've had to deal with this social injustice, right? Black fatigue, you know, having to always answer and be a step above, it becomes very tiring. So we want to first make sure we understand what we need to be treated for. So if you're feeling any of these types of things, you're feeling anxiety more than normal, if you're feeling depression that you're not usually feeling, these are some signs that we may need to ask the question or make the statement, hey, I might need help. Then we start looking for, okay, what kind of treatment can I get? And there are different levels of treatment. I like to tell my clients all the time that counseling is not just going into counseling. You get counseling from your teacher, you get counseling from your mother, you get counseling from a friend, you get counseling from your pastor. You know, there are different levels of counseling. When you come to the professional level where we're at, then we believe that the issue that you're dealing with was unresolvable at the other levels. And so we want to seek out more help. And so that's what we want to do. So we want to understand what we are actually getting treatment for. I don't want to take it all up. I just wanted to at least share that part. And I'll let Dr. Mays share her part.
I totally agree with what has already been said. And I'll just add that you know, being observant, and one of the ways that you can consider what you might need to do to take the best care of yourself and your loved ones is just being in tune with yourself, noticing if you are not sleeping as well as you are accustomed to sleeping, if you are finding yourself being fearful, you know, more than what is, you know, typically expected when you go out, you know, with the pandemic and the threat of COVID, you know, that you find yourself being not just aware or alert, but being a little bit more fearful than you would normally be, or finding yourself maybe having some physiological effects. Maybe you feeling yourself feeling like you're maybe hyperventilating or breathing, or, being a little bit more watchful and nervous, what we might tend to label as anxiety or panic associated with the pandemic that's going on. And you feel like you just really can't get that under control like you normally would. Those are indicators for you that might prompt you to speak with someone about that. And I would like to just add, and paying attention to your children and your grandchildren. I personally have seen more teenagers during this pandemic for depression, anxiety, even panic attacks, because, and isolation, was a contributor to, the onset of depression. People, for teenagers, high school and being around their peers is their entire life. And so to be told that you have to stay home with your parents all day or stay in the house and not be able to hang out with your friends, that's like a death sentence for some children. And I'm making a little bit light of it for levity, but the reality is that for these young people, it is serious. It does become serious when that separation brings on anxiety and depression, and that depression goes deeper and becomes, some evidence of suicidal ideations and the like. And that's been the bulk of the new clientele that I've brought on since the pandemic.
Dr. Mays, you just go ahead, Dr. Mays.
Yeah, I was gonna share just a couple of things, because now we ask for, well, what kind of treatments can we give? What can we do to help individuals? Of course, it was spoken about a little earlier about coping skills. What are some coping skills that we can build up, right? So one of the things that we work on is, of course, education. If you know more, if you know better, you'll do better, right? So if you know some things, we can, some of the treatment is just to educate you on what's going on with yourself, how to, like we say, assess ourselves and know what's going on inside of us, how to be able to do that. Another one is mindfulness, right? A lot of times we hear that big word, mindfulness. Well, it's just about taking the time, taking those deep breaths and relaxing. Anxiety is that thing that gets us all amped up. We're amped up. But if we take deep breaths, relax, get into that place of focusing down, because what happens is we have so many things going on in our head, and we want to focus you down to just one thing, one peaceful, calming thing, right? That's one thing that we can do. Of course, we tell you, try and get exercise, eat right. These are very easy to do in a sense, just getting out in the sun sometime, taking a walk. These are some things that you can do. And then finally, of course, what we're doing here, sharing with you, is talk therapy, right? We know that one of the greatest therapies to getting stuff off our chest is talking to someone. We need to make sure that someone is safe. We need to make sure that someone is someone we know, that we feel comfortable with, and that they're not going to share our information. So you can't just talk to any and everyone. However, talking to someone helps to get it out, right? It helps to let out some of those things that we've been holding in, because we can become like a soda can, right? With all that pressure built up. And if we keep shaking and shaking and shaking, what happens to the soda can? It explodes. Typically, who does that soda can explode on? The people closest to you, the people you love the most. And so how do you prevent that explosion? You treat it like a soda bottle with a cap. Every once in a while, you take that cap off, let some air out, put it back on. Release a little pressure, put it back on. That's that idea of talking. So those are some things that the treatments that we want to that we would share, and that and there may be more. These are just a couple of the ones that I thought of right offhand. If anyone else wants to share.
Dr. Austin, I wanted to just throw in as well that some people benefit from support groups, and that's where that talk therapy, sometimes is very helpful. And then we have, I think prior to the pandemic, we were all so busy, so busy. And now we've kind of slowed down to some degree, but we're getting ready to amp back up, to some degree. And so I do think that it's quite interesting, and we didn't realize, hopefully we took the time to do some introspection and reflection about really what, was good, where we, because my husband tells me, sometimes you just need to rest, you just need to relax. And a lot of times we create a lot of the anxiety and madness in our lives because of that. And so I think one exercise, definitely, you talked about mindfulness. I think that is really, really important, in terms of treatment opportunities. Yes.
Thank you. Thank you. Someone just put in the chat, and I thought about that because I do have that. They say if you have a Fitbit and other fitness trackers, but I know this person talks about Fitbit, there's a 2-minute breathing app called Relax that helps with relaxing. It's been beneficial to Carla, and hope that maybe it could benefit someone else. So just wanted to throw that out as we were moving along. I know Dr. Dora Mays, you mentioned it, and Dr. Michael Mays as well, but the next question that I want to throw out to the group is, what happens if we don't get the treatment or the help that we need? What happens then? Dr. Hill, Dr. Mays, we got Mr. Massey, Dr. Connor, Ms. Anderson. What happens if we don't get the help that we need? That explosion you just talked about, Dr. Mays. What happens if we don't get the help that we need?
Well, that's what I was getting ready to add. Dr. Mays, Michael Mays, he said it poignantly, which is, if you do not let it out, it's going to come out one way or the other. And how it manifests itself is where the concern lies. So again, it was said earlier in the introduction, and again, thank you for having me as well. But you said in my introduction that I was a certified mental health first aid trainer. And one of the things that we focus on in that training course is essentially making individuals or making people aware that, one, it's okay to talk about what's going on with you. It's okay to talk about mental illness. It's okay to talk about your problems. And as Dr. May said earlier, it's finding the appropriate settings, the appropriate people to share those issues with. It's normal for a person to enter the room and say, "Hey, how you doing?" And a person just by default says, "I'm good, how are you?" Now, but what do you do when someone says, "Well, I'm not doing so good"? Usually there's an awkward silence. And then that individual will say, "Well," or not say anything at all. And that's one of the things that we have to overcome as a community, as individuals. And that is simply knowing that it is okay to engage that person and give them an opportunity to have that outlet.
Thank you, Mr. Massey.
I wanted to add that one of the things that I see quite a bit as a pharmacist is that people have underlying mental illnesses, but it manifests as a physical problem. And it might be high blood pressure. It could be can't sleep, problems with sleeping, the appetite change. And again, so some of the things that I was talking about earlier, or pain, complaints and things of that nature. And so a lot of times we just internalize it and it almost eats us from the inside out. And so, recognizing that, and that's why oftentimes people will say, "Oh, you need to exercise, you need to eat better," because a lot of times that will help our body naturally create those chemicals that allow us to, feel better and at least be hopeful and things of that nature. But I typically see that. The other thing that I've seen is a lot of substance abuse or substance use. And it might be alcohol, it could be illicit drugs, it could be overeating, it could be overspending money, or other irresponsible kinds of behaviors to try to treat yourself without taking pharmacological therapy. And so those are some of the other things that, you see when people aren't necessarily getting the right kinds of treatment. And so, and even people who are taking pharmacological therapy, when they're not getting the cognitive therapies and the coping skills, sometimes you'll see, again, these other patterns of behaviors manifest, the substance use, or and I'll say use because that's typically the intent, is to use, but it can graduate to an abuse or other problems in that regard. Mhm.
Thank
And
you.
I would also just add to what Dr. Hill mentioned, in that, you know, it has been my experience when I'm working with people from our community, you know, it's almost a fear of theirs that, you know, that when they come to counseling, that I'm going to suggest, or the counselor is going to suggest, that they take medication, and they're adamantly opposed to pharmacological intervention. Um, and I have spent quite a bit of time explaining to people and trying to help them understand that pharmacological intervention is not the worst that could happen, and trying to give them an education on the necessity to make sure that they're chemically balanced so that they can even receive the cognitive behavioral intervention that's happening. Because sometimes, you know, when you're so depressed because you're chemically imbalanced, you can't even receive what you're getting through counseling. You need some intervention that's going to help to get you to a place where you can even focus on the other treatment modalities that you're trying to access and utilize.
I think that it's important that we understand fully that the physical affects the mental, and the mental affects the physical.
That's right.
And one of the main things that we as therapists have to make sure that we do is we assess and we address the physical. If a person comes in and says, "Hey, I've got this problem mentally," da 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 da. Well, have you seen your doctor? Have you talked to, you know, medical, to make sure we rule out medical? And I always use the example of my own mother, who we thought had some, you know, mental illness, and so we took her to see the mental doctor, see the doctor, and the psychiatrist told us this is the issue she may have, prefrontal dysplasia, something like that, where she's not thinking right. But they said, before we can do it, we have to rule out. So we need to get a CAT scan. So they took her to get a CAT scan. She had a tumor. Boom. So that immediately ruled out the mental and automatically made it a physical thing. Of course, they did the removal, and, you know, it helped. But anyway, the bottom line is, just because you're physically not feeling right doesn't mean it's a mental problem, or it could be either one. You got to get it checked out. And that's what we have to stop, is that stigma of, you know, nope, I don't need no help. Nope, I don't need to get help. You know, medications are important. You need them, right? But you have to go through the right process in either side to make sure that you're getting the help that you need.
Well, you know, Dr. Mays, you brought up a good point, because the other thing sometimes in that workup process, from the mental health side, a lot of times we are checking the thyroid gland, or we're checking to make sure there's no anemias, because those are examples of medical problems that can also make you, you know, present like you have
Yes.
depression, or can affect your sleep and things of that nature. And I want to also, because we have the church here, to say that when we talk about treatment, there has to be a holistic approach. So
That's
this
right.
is where I do feel that feeding yourself spiritually is really important, and being in tune with who you are, who your higher power is, and spending that time to feed your soul, and however that means for you. So some people enjoy going to church, and that really is all that they need. The socialization and that reaffirmation and the positivity that comes from that may be all that they need. Or if you add that to pharmacological therapy as well as the cognitive therapy, they may be on their way. But some of us also need to do yoga, or we need to do meditation, or we're doing Pilates. Some of us are athletic and get involved in sports, or we have hobbies. My mom, you all saw her earlier, she crochets. You know, some people are artists and things. So I do think it needs to be a holistic approach. So when we say treatment, most times when you go to Dr. Mays, they're going to be discussing, or Antone, they're going to be talking about those two major buckets, but it really is about feeding and taking care of our whole self. And when there's
That's
an
right.
imbalance in one, it does affect the rest of our being in that regard. And I have to just say too, working with older patients, oftentimes, you know, we end up, the brain can't focus and can't concentrate when it's not being fed well. Um, and so then depending on how old the person is, we default to, oh, it must be Alzheimer's disease, but sometimes it's other things. And now in the face of COVID, we're seeing where the infection itself is starting to affect the brain, and it's manifesting as a fog of inability to concentrate. We're now suspecting that it's damaging the blood vessels, which can affect, you know, blood flow to the brain, and hence, you know, maybe influencing some of what we're seeing in terms of Alzheimer's disease. So it's pretty complicated. So we have to take care of ourselves holistically, whatever that looks like.
Okay.
Yeah,
Thank
I would just like to, you know, make sure I said this. This is a little push for my wife, but she has a program called Life Quest that really encompasses that what you just said, Dr. Hill, about the whole person. You know, I can let her explain a little better than I can. But it is a great program. I've seen and talked to people who have gone through the program with her, and they have found, lack of a better statement, new life. You know, so you are absolutely right, Dr. Hill. The whole person is critical. We can't just fix part of it. It's like taking a bike and only fixing the back tire, but the front tire is still broken. You know, so.
Yeah. And the good thing is, if we discover your thyroid is not functioning right, we're going to give you medication for that, and you take medication. And I know Dr. Sneed oftentimes says, you know, with COVID and things like cancer, if you knew you had cancer, you're going to be asking, will chemo get it? Will radiation get it? Or will surgery get it, right? So it's the same concept when it comes to mental illness. We need to be open to treating, you know, how by any means necessary.
Right. And Dr. Dora Mays, I know you see a question that's specifically geared to you there about the Life Quest program.
Yes, I answered directly to the individual
Great.
that asked the question, but unfortunately, I don't take insurance. But I will just give you this little seed. I have been working for many years on a book that encompasses the tenets of Life Quest. And I am working with a publisher. I signed a contract with Trilogy Christian Publishing, and they're publishing my book Life Quest. And I hope in the next couple of months to have it out and available for people to purchase and be able to get the content of that program.
Great. Thank you so much, Dr. Mays. Dr. Hill, as you all were talking, you actually took us to another question that we also need to take a look at. And we've talked about how it has impacted Black and Brown people through this pandemic, you know, mental illness. But let's talk a little bit about, you know, perhaps some of the subgroups, the differences across gender and age. Particularly, we may have Dr. Michael Mays and Mr. Massey talk some about mental illness and the impact, particularly on Black and Brown men. And then Dr. Hill and Dr. Connor, I know you all both work with our more senior population. So could we talk some about how mental illness affects, you know, not only minorities, Black and Brown people, but some of those subgroups across gender and age, and even others that some of you would like to mention?
Well, I guess I'll start. It was touched on a little earlier, and that is with men specifically. We succumb to certain stereotypes, if you will, in that you know, we're reared to be tough. We're taught that we're supposed to be invulnerable to pain and things of that nature. And you know, if we follow those stereotypes, it also says that men don't even ask for directions. So if we're unwilling to ask for directions, imagine how difficult it is for a man to say, hey, I think I might need some help, or hey, I'm struggling here. Somebody help me. So that's, I think, one of the main challenges that men face. One, recognizing that, you know, you don't have to suffer in silence, because that's what we default to. And instead of asking those questions or disclosing that information because we fear appearing weak, we need to be tough. We need to be resilient. We need to be the provider, the rock. And so we choose to suffer in silence. And that is a huge issue for men in general. My wife even comments from time to time that, I know you got a lot to do this week, but I'm here to help. So just let me know what it is you need. And then I can't even figure out what it is to tell her. Well, I can do this, I can do that, I can do that. So I'm just going to do it. I'm not going to bother her. And that's kind of the mindset that most men will approach many tasks, whether it be mental health, whether it be just something around the house to do. And I'll take a step back and let Dr. Mays chime in, but I wanted to just, expound on that part.
I just want to add to what he said, and that a lot of the clients that I get, it's after it's gotten so bad. We're at that explosion moment, and they've been given an ultimatum. They recognize that things are really bad in their situation, and then they're desperate. And it's difficult to work on I'll use this now, a patient who's bleeding out. You know what I'm saying? It's kind of hard to, when the artery's been cut and now you're bleeding out. And so one of our big challenges is that we wait till the last minute. When we finally do realize that we do need help, and we try to go in, it's like, we're in desperation. And it's difficult for any doctor, any therapist, anyone who's helping to help you out when it's like you're at that last final section. So one of the things, and that's one of the things I deal with more than anything else, is that I do get a lot where the wife comes in and says, well, I'm coming to you with the hope that I can bring him in, and so that's one of the things. And so, yeah, it's difficult to get us in, but it's a lot because of, like Dr. Matt said, it's the stigmas. I can't, I know how I can do it myself. I don't need no help. I don't need nobody to tell me what to do. Those types. And I've actually had them, people say that I'm only here because she made me come, because I don't think we need it. I think we can handle it on our own. And then I hate to say this, but a few months later, he's coming in. Oh, well, she left me. Whatever the case may be. I deal a lot with marriages, So men need to stand up, and it's us. The education part is big in my mind. So I hope that was just to add to what Mr. Massey said.
Would others like to talk about the men? And I know, as I mentioned, Dr. Hill, you and Dr. Carn and some others, even as we talk about as we grow older, how, our mental health differs and what mental health issues we deal with as we take that journey.
Well, good evening, everyone. I'll talk a little bit about this. I think one of the challenges as we age, it goes back to some of what Dr. Mays was speaking about regarding this stigma. A lot of the and particularly older adults that are Black and brown that I work with have a great deal of stigma about what it means to have a mental illness and to seek treatment. I remember one of my very first research projects was in a community health clinic in Pittsburgh, Pennsylvania, where there were doctors reaching out to us to try to figure out why they were having, large numbers of older African Americans who they were diagnosing with depression in the primary care setting. We're giving them scripts for antidepressants and anti-anxiety meds, and they just weren't getting the scripts filled. And they didn't know why. There was a huge disconnect there. And upon doing some focus groups and interviews, we learned that, first of all, many of them didn't like the term depression or anxiety. They were using different language. They were like, well, I don't have a mental illness. I'm just feeling a little down. I just have the blues. I'm just going through some things. And so I think that cultural insensitivity piece is a huge barrier from getting folks into care. I think that also as beautiful and as amazing as a religion can be as a coping mechanism, and that unfortunately in our Western society, we don't always recognize culturally sanctioned approaches to coping and healing. But in many cases, and particularly for older adults, it can serve as a barrier where people are, as we talked about already, getting messages and myths that, if you're needing to see a professional clinician, then you're not praying hard enough, your faith isn't strong enough, and that there's something else wrong there, and not recognizing that these two things can go hand in hand. I think another challenge is as we age, we're prone to more chronic illness. The trade-off with living longer and having medical advancements means we're also living with chronic conditions and multiple conditions as we age, and multiple chronic conditions are correlated to having mental health conditions. As we've talked about already, physical and mental health go hand in hand. And we see very high rates of comorbidity between chronic illness, back pain, and anxiety and depression. And oftentimes the folks that I work with think that that's normal and that there's really nothing that they can do about it, that depression, that anxiety, that those are normal parts of aging and that there's nothing that anyone can do to help them. I wish that we were targeting more messages to our older adult population and helping them to understand that they don't have to suffer through mental health concerns and that there are treatments that are very effective and helpful. But that messaging somehow is still getting lost in translation, and we could do a better job to grab that population in particular.
Wow, thank you, Dr. Connor. Dr. Hill, anything you'd like to share? Because I know you work with that population as well.
And I was going to say, I agree wholeheartedly with everything that has been said. And I just wanted to add to something Dr. Connor said about the older population. And I think part of our messaging needs to be, it's okay. It's okay. It's okay. Because talk about resilience and talk about strength and talk about grit. Most of them can tell stories about just life and living that, so many of us being younger can't appreciate or probably wouldn't put up with, be able to go through. But what I did want to just add is that, let me see, yes, that we need to be mindful that at different age groups, sometimes mental illness, especially things like depression, may appear differently. So, children, for example, most times their socialization with other kids, may be something that is starkly different. Bedwetting might be an example, of something that suggests that they're having some issues. With adults, again, you may see this pattern of relationship issues that Dr. Mays talked about, or substance use kinds of things, and just not self-caring. But older individuals, sometimes we get into a lot of the psychosomatic kinds of things where it's okay to have nerves, but not to confess that I'm depressed. So again, as Dr. Connor talked about, some of the terminology and things that's being used, we just see acceptance of certain disorders. Like I can have high blood pressure all day because everybody gets that. But for me to be, say I'm going to see a psychiatrist or I'm going to see a counselor, sometimes there's a struggle, with certain sects of the population for that. And so I would love to just send a message of it's okay. It's all right. You deserve. And again, whatever treatment or approaches we take, it's just about treating the person holistically. It's not that anything is wrong or that they did anything wrong or that their parents did anything wrong. Life is happening to all of us, and life, particularly since the pandemic, has been rough for all of us. And again, that's why I said, I know we all have a friend that's experienced something. And, the other comment that I wanted to make in relation to grief is that sometimes we just think grief, once the person is buried, we're done with it. And we're not. Sometimes we hold that inside. In this pandemic, many of us have lost numerous people and it's so close. And that whole process of grieving has been shifted because of the pandemic. Now we're watching funerals by Zoom, and things of that nature where we can't have a repast. All the things that have been so crucial, particularly in the Black and Brown cultures, to that grieving process and the ability for it to, for us to transition appropriately, during those stages. And so, again, my messaging would just be to everyone, it's okay. It's okay. If you're not feeling, your best, it's okay. But we just want you to know that there's treatment out there. So, okay.
That's great. We talked about Black men and some of our seniors. I just want to share, I had a conversation with my pastor today about a family in our church, a family of super Black women. So Dr. Dora Mays or some of the others who work with Black and Brown women. Would you really be able to share? I mean, one of the things that we were talking about this morning was, how do you deal with, with us who particularly culturally, we're supposed to do everything all the time, take care of everybody. I mean, I even mentioned that I went to a conference in which a white woman said, as far as leadership is concerned, let the Black women lead, because when they lead, they take care of everybody.
Wow.
That's right. That's exactly what she said. When Black women lead, they take care of everybody.
Yeah.
Wow. Yeah, I think that's a fabulous topic you just brought up, Dr. Austin. I was sitting here thinking as I listened to others speak on this subject about, culturally as people of color, we tend to use the church and our belief system to avoid getting the help that we genuinely need. And I want to tread lightly here because I definitely do not want to offend anyone. I personally choose and our practice amazing services, Michael, also, we advertise ourselves as Christian counselors. It doesn't mean that you have to be a Christian to come and receive counseling from us, but what it means is we are very transparent and upfront about the foundation we stand on when it comes to counseling. And I said earlier, many people come in and they say, I want to come and see you because I don't want to get on medication. And they wrongly assume that I'm opposed to pharmacological intervention, and I'm not. I think there's a place for it. And so education happens. But what I wanted to say is I applaud, Carmel is part of the partnership for this event tonight. And I want to publicly applaud the pastor of Carmel Friendship, Quincy Stratford, because he promotes counseling and getting counseling. And he's one of the few pastors in a Black church or a Black pastor who I know does that. Most of the time, pastors are like, all you need is Jesus. Well, yeah, we all need Jesus. We definitely do. And he can do it. Yes, he can. But he also gives us wisdom to take advantage of the gifts that he has placed in the body for the edification of the body. And so, if counseling is what you need, then get counseling. Keep praying and keep trusting God. But if counseling, sitting down with a human being and working through and processing what's going on in your life that is causing you distress, if that's what you need, get it. It's available for you. And so I want to reiterate what Dr. Hill said. The whole person, mind, body, spirit, the whole person has to be well. Treat the whole person. And those strong Black women, back to your point, Dr. Austin, that's, I believe that is culturally ingrained in us because of our heritage and what we've had to come through and survive through. And so, you know, when our men were absent because they were being treated the way they were being treated,
And treat it now.
Mhm.
we had to take care of the family and step up and do what we had to do to survive. And
Mhm.
so it's hard to dial that down when it's been put in you at such a
Yes.
significant as part of your foundation in you. But I think that it's important for all of us as strong Black women to be in tune with ourselves and know who we are and when we're off, when
Mhm.
something's just not right, and be strong enough to step up and ask for help. Raise our hand and say, I need you.
Mhm. Mhm.
That gospel song, I need you, you need me. So relevant, right?
Yeah.
Yes.
So relevant.
Yeah.
I would like to share a little of this. You know, I have the pleasure of working with many strong Black women, and the majority of them, I can't think of one of our strong Black women who wasn't in there because they want to be better to help others. And one of the things that I try to get them to understand is they got to take care of themselves, right? So often, strong Black women will be so giving, so helping it to the detriment of who they are. And so helping to build strong self-esteem, helping them to be more aware of what they need, and sometimes taking that break, building those boundaries has to be done. And they're willing to be open and get the help and do the things that they have to do. And so often they take the blame for why the relationship's not working, or why the children don't, why they think the children don't love them or don't want to respect them. So yeah, that, you know, that strength that they have can sometimes take them places that they don't even need to go, because they need to look at self and say, hey, look, I am good enough. I am worthy, right? Because we can go back and look in history and see how our strong Black women were treated. And that's a lot of times where that lack of self-esteem, lack of self-worth comes from, because they looked at what other people said. And then we go to that spiritual connection. You know, I work with my clients a lot and I say, what does God say about you? Right? That's that spiritual connection. When we talk about medications, and when you said it, my first thought was, well, Luke was a doctor.
Mm-hmm.
And he wrote a whole book. He didn't necessarily walk with Jesus, but he wasn't one of, but he knew, and he spent enough time to see and get in it. But he was a doctor, right? So obviously, medications and doctors are very, very important, but we have to look at the education of all of that. So anyway, I just wanted to add a little bit into there from my experience.
Great. Thank you. Thank you so much, Dr. Mays. We have been talking about resources with things that we need. And so we want to spend a little time before we go to Q&A talking about community resources for mental health. So Mr. Massey, could you share with us a little bit of what services are available to support mentally ill individuals in our community? And with that response, would you please make sure that you comment on mental health first aid training?
Okay, I actually made a little cheat sheet for that because I knew I wouldn't remember a lot of the resources. But first and foremost, there's the NAMI organization, is NAMI.org, and one of the unique things about this particular resource is it's not just geared towards individuals who are diagnosed with a mental illness or substance abuse, or have some issues in that arena. It's geared also towards the caretaker, towards the family, towards the community. So anyone, she did a poll, Dr. Hill did a poll earlier, asking how many of us know, have a friend or have a family member who's experienced issues with mental illness. Well, if your hand was raised on any one of those questions, NAMI.org, has something for you, from support groups to more resource lists to chat rooms to, it's a wealth of information that's available for you. In this age of technology, there are a lot of resources that extends the scope of what's available, because I could easily talk about what's locally in the Tampa, Hillsborough area, from local hospitals, whether it be private organizations or um, outpatient services or counseling services like the Dr. Mays and Dr. Mays, amazing services, um, to facilities like where I work. I work for Northside Mental Health. There are a slew of resources on a local basis, but because of technology, you can also explore and be able to connect with specific resources that you can relate to, because that's another one of the things that serves as a barrier for Black and brown people. And that is, we one don't want to seek services, but when we do, we want to find services from people who look like us, or at least have some semblance of being able to understand us and our journey and our past and our history. So technology allows you the opportunity to do that. For example, there is one of the resources is Black Emotional and Mental Health Collective, and the acronym for that is BEAM. And they provide education, they provide training, advocacy, and creative arts as a way of expressing yourself and gaining the healing that Dr. Connor was kind of mentioned earlier when she does her dance. So it's one of those types of resources. And then we have Black Women's Health Imperative. It's an organization advancing health, equality, equity, and social justice for Black women. So there are many resources out there that are available to you, and I don't want to necessarily just run down a list of resources, but I want to convey the idea that um, if you think you need some type of help, there's a resource for it. You just have to be willing to just open your eyes and look, whether it's you doing a Google search, picking up the phone books, and yes, they still pass those out, ironically enough. Yeah, the resources are available to you, but two main resources that I wanted to talk about before I move on to mental health first aid, and that was the National Suicide Prevention Hotline. Um, that is a 24/7 resource where if you just need to talk to someone because you're in a crisis situation, um, even if it's not suicide related, they're available. There are counselors, trained individuals who are there to be able to assist you and talk to you and help you find the resources that you need. And nationwide, the 211 service is available as well. And again, it's almost a switchboard operator who can tell you, here's who you need to call, this is where you need to go, or let me patch you through so you can talk to them. And they actually do follow up as well. And there's also a crisis text line. So if you don't want people to see you, you don't want to give them too much information, you can actually text. You can actually text a number and just say, "Hey, I need help," and a counselor will respond to you. If I'm not mistaken, there was a resource that was put together by Dr. Hill, and so hopefully you guys will have access to more specifics on these types of this type of information. But in regards to mental health first aid, if you I'm pretty sure most individuals have heard about CPR or first aid in general, and they're not designed to make you a heart surgeon. They're not designed to make you a medical doctor, but what they are designed to do is essentially prepare the individuals who take those courses to assist in a crisis situation. If someone is having a cardiac event or a life-threatening emergency, they're trained so that they can assist immediately and appropriately until help can arrive. And that's essentially what the concept for mental health first aid is all about. It's CPR for the mental health population. And what that means in short is, and I'm sorry, I saw a question earlier in the chat that kind of touches on this. Someone asked about how do you approach an employee who has an employer who has difficulty. I'm sorry, I'm not going to articulate it right. It's way up the chat now, but it was basically the sensitivity issue at work. And one thing I would like to express is with mental health first aid, what it does is it puts you in a position of understanding how to recognize crisis situations, or how to recognize when someone is having a mental health. Some individuals will call it a psychotic break, or a psychotic episode, or a crisis situation where they're in need of help, cannot articulate it, may not even realize or understand what's happening to them to be able to ask for help. But it places you as the participant in this course in a position to be able to recognize those situations and make the appropriate types of responses. Just being available for them, being able to seek help or call for help, being able to direct them to professionals like the Mazes or myself, so that we can assist them appropriately. Where the course is not designed to train you on how to be a counselor. It's not designed to train you to be a psychiatrist. It's designed to help you realize and recognize those situations so that you can be of better assistance to your community members, whether it be a family member, a friend, or a stranger. It puts you in a position so that, as I stated earlier, it puts you in a position to where that awkward silence goes away when someone actually responds to you asking, how are you doing? And you can actually engage them, give them an opportunity to express themselves, get it off their chest. And sometimes that's all that's needed. But being able to understand that respect is warranted, whether the person reciprocates that or not, that's beyond the point. The fact of the matter, if they're going through a crisis situation, if they are in need of help, you're making yourself available and being respectful to them, showing them that they are important, even when they're going through what they're going through, can mean a world of difference. It could actually, in the long run, save a life. Because we as individuals, as a community, we're social. We're social beings. And with the state of the world right now, with the pandemic going on, and on top of that, with the highlighted notice to all of the injustice in terms of racial injustice that's going on in the country, that was said earlier, that it's been going on forever. We're just now starting to see it mainstream because of the technology. But the reality is, Black and brown people have always experienced these pressures, these norms. And to couple the COVID pandemic on top of that makes it even that much strenuous. And although we're a resilient people, and we'll come through on the other side of this, it's important to understand that when we do, we need to be in a position so that we're better prepared to face the changes that are resulting from what we're going through now, because the world is going to look different on the other side. And so mental health first aid is designed so that you as individuals can help your community remain safe, help your community through any type of crisis situations that may occur. This puts you in a better place to understand what's happening and be able to help.
Excellent. Thank you so much. Thank you so much, Mr. Massey. I have a question for Ms. Anderson, please. Ms. Anderson, WeCare recently partnered with you and Dr. Connor on a project focusing on African-American people sharing their stories with mental illnesses. Could you please share with us about that project?
Oh, sure thing. Thank you so much, Dr. Austin. So we partnered with This Is My Brave, which is a national nonprofit organization whose main objective and mission is to debunk the stigma that's associated with mental illness, not just for those living with mental illness, but for those who are caring for or even associated with like loved ones who are experiencing mental illness. I'm sorry, give me just one moment. Sorry about that. Working from home struggles. So yes, it's a national organization whose main purpose is to debunk the stigma that's associated with mental illness, and they do it in a very unique way. So they do it by storytelling, by using the creative arts. So individuals can either perform poetry, can either engage in like a music selection, or even just by acting out or sharing their story, however way they see fit. So this particular episode of This Is My Brave was incredibly important because it was particularly highlighting the stories from the Black community. And for, I believe This Is My Brave has been around for almost like 12 years. So this past January, as well as in February, this was the first time in This Is My Brave's history that it's actually had a special episode dedicated to highlighting the stories from the Black community. As we all know, that our culture is rooted in storytelling. As you can think back to even when you were able to sit at the feet of like your grandparents or even the elders in your community, a lot of our stories, all of our stories were told through a rendition of survival, of triumph, of progressing and thriving through difficult circumstances. And so when it comes to wanting to understand the stigma and wanting to bring light or truth to this thing that's very often taboo, we thought that it would be incredibly important and instrumental to highlight these stories from the Black community. And what that really looked like was having individuals who are either living with a mental health condition, ranging from various spectrums. So for those who did watch either one or both of the episodes, you were able to hear stories from individuals who are living with depression, all the way those who are living with paranoid schizophrenia. But then you were also able to learn from caregivers of those who were caring for individuals living with a mental illness. So we had either professionals or even family members who were caring for a loved one who had a diagnosis of mental illness. And so This Is My Brave, the stories from Black community, was very powerful for several reasons. So one, we also included like an African dancing segment. And so for those of you who had not had the pleasure of witnessing an African dance ceremony occur in front of you, it is very ethereal, like it's something about it. It's an aura. It's something that makes you feel even more connected to your ancestors, than you're just able to be there. But then also being able to truly witness and hear different stories of lived experiences with mental illness. Those who have watched it, they learned a lot. They said that, oh my gosh, there's like these people look like me. And I was like, yeah, that's part of like debunking the stigma. Mental illness is something that we can't really see. Sometimes when we think of individuals who are like on the street, let's say we're going down the street and we see someone who may be talking to themselves or maybe interacting with the world, that how we're not perceiving it, we may think something's off. And that's their perception. When I teach mental illness with my students, I describe it as that's the differences in perceptions. So an individual who is living with depression, they have a different perception of how they're living through the world than how a neurotypical person might. And same thing for the individual who might be living with schizophrenia. And so through This Is My Brave, we were able to highlight the normalcy of it. So individuals who have like climbing the corporate ladder, they were sharing their struggles with anxiety. Individuals who are at very prestigious universities were sharing their struggles with living with depression, and how the desire to be perfect kind of sort of made those symptoms worse. And even individuals who were also mental health care providers themselves were able to share their stories, like, yeah, like I relate to my clients because this is my own lived experience. So that is what This Is My Brave is mainly about, highlighting that yes, mental illness looks different across everyone, but really bringing voice to an often silent community and saying that yes, even though I am Black, I am still allowed to be human, and part of my human experience looks like a person living with a mental illness, and that's fine too.
Excellent. Thank you so much. Thank you so much, Ms. Anderson. That's tremendous. Now, was there something that you wanted to share with us?
Yeah, so I actually do have a video just kind of sort of like highlight what This Is My Brave is about. So I will go ahead and share my screen since I get this all going.
And once we do that, we'll move to the question and answer session. So if you have other questions, please put them in the chat. And Mr. Green, if you'll help me scroll back up to make sure we didn't miss any questions, I much appreciate that.
I sure will.
Are you all able to hear the video? No. Okay, give me
No.
1 second. This usually happens when I teach my class too, so you think I'd have this figured out.
So,
All right.
yeah, making sure when you share your screen that you engage the audio.
You all probably still can't hear the audio, right?
No, Miss Anderson, probably go out
Yeah.
and you go in to share, stop sharing. And
Right.
then come back in, and when you share, and it'll ask you about sharing audio, it should be down in the lower left corner,
Yes.
and that should allow us to hear.
All right. I believe that worked. Thank you so much.
I studied psychology, and I would read textbooks like abnormal psychology. And I would look at a picture of a person with mental illness, and it didn't look like me. So I said, oh, I don't have no mental illness. But is there a look? No, anybody can get mental illness. It's a false image of what mental illness looks like.
While trying to distract my mind and push out any extreme possible outcome that was playing as a scenario, the phone call came in. My friend is dead. The words rang pain in my ears, and wrapping my head around the news was not something I was capable of doing. Then I learned the details. He wanted to leave as a soldier and jumped into the train tracks and marched to his death. May 28th, 2006, my 15-year-old friend took his own life. A guy who had a rough upbringing and an emotional story, but had the silliest, crooked tooth, infectious smile that always wanted to ensure those around him were happy, took his life, and I could not process this. My first taste of mental health within our community and not recognizing the signs, the fact that there were signs, and even understanding what that means to be emotionally and mentally unwell. This was age 14.
From church skinny ties to flat-built hats and matching shoes, from finger waves to Gumbies, mini froze to dreadlocks, fresh fitted, the freshest of the fresh, ready to grab her hand during couple skate or bring home a report card. On these days, we're all Black boys. All body bags, all filled with holes, all autopsies, all unrecognizable, baptized in sirens and secrets, unaware that others could supersede our skin's darkness. On these days, we're all Black boys, our spirits drifting into the night sky. Nephews, cousins, uncles, aunties, Black boys. On these days, even grandfathers become boys. They stumble back in a time when this narrative was the exact same, when the entire neighborhood had a funeral in the middle of the street for the kid whose name we all knew, mother crying in the backdrop, and Black boys watched other Black boys become asphalt. On these days, even sisters become boys. Only knowing how to teach them how to find the right partner. And when they're stolen, it feels like you're breathing molasses air.
Tell them I'm brave, see it on my face. I am bigger than anything. Come tell them I'm brave.
So that was the snippet of kind of sort of what This Is My Brave and kind of sort of what the project that we are actually still actively doing and what that is a bit more about. So let me go ahead and stop sharing. Okay, so that should be good. So yeah, so we're actually currently in the research arm of the project now, and our research segment has three main objectives. And one of the main objectives is to kind of sort of survey both our We Care sample as well as our national audience sample and also our students as well. And to kind of sort of understand how watching either one or both of those episodes from This Is My Brave has impacted their perceptions about stigma as relates to mental illness, their own beliefs about seeking mental health treatment, and then also understanding like the resiliency factors that comes into play when we're talking about mental illness. And so now that we've collected our surveys, we had about 290 people respond. So that was amazing. I'm currently going through the interview portion. So actively going through the part of interviewing about 30 people to kind of sort of speak with them one-on-one about their perspectives about the program, understanding how that might have impacted like their attitudes and beliefs about mental health and even like mental health treatment seeking, but then to specifically highlight how important a series like this, since we talk about storytelling as being very integral from a culturally relevant perspective for African Americans, understanding how the act of storytelling, telling one story of a lived experience, can impact perceptions about mental health to ultimately be able to reduce the stigma associated with mental illness in the Black community. So it's a little bit more about what we're doing currently. So I hope that it did answer the question that you posed, Dr. Austin. And then, yeah, I guess we're going to move into Q&A session.
Well, I think that ending with This Is My Brave, both as the title of your project and for us to really think about who and what we are. I think that's a tremendous way to segue us into our question and answer session. But before we answer our Q&A, I do want to note that the resource guide that has been developed by members of the Carmel Friendship Health and Wellness Ministry and members of tonight's panel has been put in the chat. And so you will see that there. And I also will put in the chat the link to the library of We Care videos. We talked about the humongous number of presentations Dr. Sneed has done. So we'll put a link there so that you would know. So Mr. Green, if you would help me peruse the chat so that we can go back and make sure that we answered all questions. We're at 8:04.
You want me to go first?
Let's make sure. Yes, sir.
Okay, good. This has been a really good presentation, and thanks all for the people who presented tonight. This is an area, particularly in the communities that we are living in, that is taboo. And I think you helped to open the doors to help people understand a little bit about mental health. So thank you so much. One of the questions from Elizabeth Shelby is, as the school prepare to reopen in the fall, what can we do to help our children with the transition of returning to school?
Dr. Mays, can either of you maybe address that?
Yeah, I was just thinking about the obvious is, to educate parents and encourage parents and those children that are old enough themselves cognitively to understand, to focus on protecting themselves from COVID, by doing all of the protocols that have been prescribed by the Center for Disease Control. But in addition to that is, talking to your children about, how our normal has changed and the importance of them seeking out the resources that exist within their school environment, and letting their parents know when they feel like that they're, just not themselves, whatever that looks like, whether it's pulling away or having those overwhelming fears or anxiety, and just getting the help that is available for them. The schools have ramped up their assistance in some degrees, The community has ramped up its awareness and assistance in a lot of ways. And so just educating our children to take care of themselves in that way, asking for the help that they need.
I would like to just add on to that, being a strong encouragement to them, especially if you are, they go to a school where masks aren't required, but you want them to wear masks, then, that idea of bullying is going to come along where people are, other kids are, oh, you got to wear a mask. So you kind of want to be prepared to encourage them and to just build them up, let them know, like Dr. Mays said, educate them on why they're wearing a mask, how it helps, how it, and of course, talk to them about social distancing, continue to help them understand the protocols, but prepare yourself also for, your children coming home and having to deal with that, and that you want to more come alongside them and just encourage them. That's going to be a big thing, I believe, at this point in time.
Great, thank you, Dr. Mays. Mr. Massey responded in some ways to this question. So I'll read it in totality just to see if any others on the panel would also like to respond. As it's the question about an employee. Please provide suggestions on how an employee can approach an employer who hasn't shown any affinity towards helping or trying to understand an employee who manifests symptoms of mental illness, anxiety, and stress outwardly. The usual response from the employer is disciplinary action instead of getting to the root of the issue. So Mr. Massey, you certainly did when you talked about mental health first aid, that might be something certainly that organization, that agency brings on into that company. But do you or anyone else want to again respond to that question? Because it may be that many kind of situations. Mr. Pierre just talked about an employee, but it certainly could be in many other realms as well.
Yeah, I want to just add that in the environment that I work in, I still work as a federal employee at MacDill. I'm the director over the family center out there. And one of the things that we have began to teach our population is bystander assistance. If you see it, report it. If you see it, it becomes your responsibility as someone who witnessed something happening to say something. And so if you are the employee who is aware that the employer is perhaps missing the clues of this other employee or peer, or the other employee that may be exhibiting symptoms of mental illness, then that employer may not be aware, may not know the signs to look for. So maybe you could take the initiative to share the knowledge that you have and the insight that you have. And then if that still does not get an appropriate response, it may be necessary to elevate that concern to the next level of management.
Thank you,
And
Dr.
something
May.
else to be mindful of is that if it's a friend, like asking for a friend, right? If you are working somewhere where they offer like EAPs, so basically just like additional employment benefits, which also sometimes does cover like behavioral health as well. That's an option. And how Dr. Mays had mentioned that HR is there anonymously and they don't really know. They just say, hey, look, you're just the bystander effect, but if you don't feel comfortable, you can always like make like an anonymous report. And then also like being mindful, like HIPAA too is like this weird gray area because HIPAA also extends into the workplace. So making sure that the employer supervisor should not be privy to if an individual has a certain mental illness, even if they go through disability. It just is very basic and generic and says this individual has certain accommodations, but they don't really know what it's for. So trying to be like open to engage in that conversation if that's comfortable. And then if not, just letting you like going the route that with systems that have been in place to kind of sort of protect employees in those certain type of situations, but always making sure that that person is aware that if they are trying to seek out services, they might have EAP benefits that can cover up to a certain amount of sessions, telehealth, or even in person for that friend who might be posing this question.
Well, Michelle Hutchinson has a really a short question, but it's does the Life Quest program take insurance?
It does not. I did answer that question to that person.
You answered it? Okay, good.
It's
Good.
set up like it's set up more like a group. And so it's not something that insurance would cover, even if I did take insurance,
Right.
it wouldn't be covered.
Right. Thank you, Dr. Mays. Irene Bembry actually made a comment, which I know that many of us can resonate with, and we've talked about it this evening. And she just said, "Thank you, presenters, for the information, as we all thank you so much." And she says, as a psychiatric nurse, I recall the stigma and denial I encountered that I encountered from my hospitalization patients from the community. And she says she's very happy to hear that the faith community has begun to embrace mental well-being.
Yeah.
So churches like Carmel Friendship and some others, she's very glad to know that things have changed. She started out in her career as a psychiatric nurse. So it does let you know that things can change. We've gone over a great deal this evening. Are there other questions? We have the resource guide, the link to that in the chat. We also have a link to any videos, some COVID-19 videos, in case any of you would like to see those. And so if there are no more questions or no more comments from the panelists, I'll turn it back over to Dr. Sneed to take us home, as so to speak, this evening.
Dr. Sneed, we can't hear you.
That little red button has to turn green first, right? I was just about to say, or what I was saying, that for everyone that, and I understand everyone couldn't do it, but for everyone that kept their camera on, it was really a delight just to see people here interacting. You know, we're almost around the corner from being able to do it in person, but to have so many people on here this evening, you know, to have up to 75 people, I think on the evening, really just to have a communication was really special. That's number one. Number two, there were three themes that I think that continue to come from all of our speakers. And I just want to take a moment and thank every one of you. I just want to thank everybody for taking the time tonight. Your expertise was outstanding. Your volunteerism tonight was outstanding. But I think there were a couple of key things. Number one, you know, seek help. Number two, spiritual help. I think that came through loud and clear. And then self-help. And so I think all of that together, you know, eating right, exercise, everything Dr. Hill mentioned earlier, you know, the spiritual nature of everything that we brought here this evening. But most importantly, for those to be able to seek help and to know that there are people out there, trained professional. I learned a great deal tonight. I myself, being new to this whole thing, to the people here tonight, you know, the whole maze thing was kind of throwing me off a little bit sometime tonight. But I just want to thank the entire Maze family and group for being here this evening. But most importantly, I want to thank Dr. Hill. I want to thank Carmel Friendship. I want to thank Reach Up for once again putting on such a wonderful program this evening. And if you hear that we're having another program early on or later on, I invite all of you to come back. But most importantly, and I'm going to embarrass her in front of her group here tonight, I want to thank Dr. Hill. I've been telling her for the better part of now the past 6 months now that as we get to a point with COVID-19, the vaccines are going to take over. They will protect the majority of us. If you have not been vaccinated, I would encourage you to do it. But what is going to happen, and it has no choice but to happen, is that for many people who have been infected, the psychiatric portion of that is going to hit. And we have to be understanding of the people around us. But most importantly, we have to make sure that we get the self-help and we know how to seek help when it's going to be necessary. So Dr. Hill, thank you very much for the fact that, not only do you care, but we care. And so with that, I'm going to turn it back over to Dr. Austin, our wonderful community partner. Thank you all for your time this evening.
Great. Again, I can't say it any more profoundly than Dr. Sneed. We want to thank all of our panelists, the Mazes, Dr. Dora Mays and Dr. Michael Mays. We want to thank Mr. Anton Massey. We want to thank, of course, Dr. Angela Hill. We want to thank Ms. Erica Anderson. We want to thank Dr. Kaya Connor. Just thank all of you for taking the time on a Tuesday evening to educate us, encourage us, even inspire us in some cases, because this is a very important issue, and particularly now. So the resource guide has been put in the chat, a link to some of the videos if you all want to see that. So we want to say to you, good evening, and perhaps for the rest of the evening, we can sign off from this, this meeting and do some self-care. Put our feet up, have a glass of sparkling water, and get a good night's rest. Thank you so much.